KJ McKenzie, now 5 years old, gets regular blood transfusions. This new clean blood helps to fight the disease and minimize the chance of a stroke. His mother calls the pack of blood her son's superpowers.
He's into the superhero. And I had already had these cool little t-shirts that I bought all the boys with the capes on it. And I said, babe, we're going to go to the hospital so you can go get your new superhero powers. You got to go get your superhero juice. And he was like, okay. And from then on, I tried to say, we're just going to pretend, because he's very smart.
Yeah.
So I had to, we're just going to pretend that we're going to the hospital and we're going to get your new superhero powers. And I also say that this is a way for them to know if you've been eating your vegetables. They're going to check your blood to see if you've been eating your vegetables, because your vegetables keep you strong and healthy. The superhero powers, but the cape was the best thing for him, and he loves it. And he says, I had to go and get my superhero powers, and he feels stronger, and it helped ease him into the process. It really did.
With the exception of its frequent bouts with sickle cell, Alan leads a normal life. School, playing, and doing the normal things that an 11-year-old does. But Kelly must continue to monitor the things that could cause a crisis.
Alan really understands that since with his disease, that there's some limitations. He knows that he's very easily dehydrated, so he knows he has to hydrate himself. He has to drink plenty of water. He knows that he cannot go swimming if the water's cold. He knows he can't go outside and play in the snow for an extended period of time because it may trigger a crisis. So he knows now what he has to do. So one birthday, I took him to Kalahari, and looking at him, his cousin, and they were really excited. So, he wasn't excited, so I looked at him and he said, Dad, am I going to be able to swim? And I said, yes, son, the water is really warm. And then he got excited. So he was really worried whether or not, my dad's taking me to a water park and I can't get in the water. But it was a water park that, had warm water, so he was able to swim.
It's a struggle. It's a struggle. There's no question about it. It's a struggle. But there are patients who go through life and they are adjusted so that just the portion of their lives that's affected by pain and sickle cell disease, they pay attention to, and the rest of the time they're just happy little youngsters running around doing their business, going to school, playing sports. It's when they are sick that they try to kind of minimize that period of time if they're well adjusted.
Each one of these parents and their kids face these challenges of the disease with courage and faith, with endurance and strength. Brooke is now 11 years old.
I think because she has witnessed how devastated I am when she gets sick, and because she cares for me so much. And she's the most courageous person I know. The other day, I was taking her to school, and she was half smiling at me, but it's like mom's intuition. I knew something was wrong. And I looked back at her and I said, Brooklyn, what's wrong? And she said, nothing, Mommy. I'm okay. And I drove a little further and I stopped at the light and I kind of glanced back and I could see her, and then I saw her eyes and I could see the tears. And I said, baby, what's wrong? Tell me. And she was like, it's okay, Mommy, I can make it.
Even though many have suffered from sickle cell disease, some have lived long lives with minor pain. And those who have been cured with chemotherapy and bone marrow transplants.
There is a cure for sickle cell disease. It's called bone marrow transplant or stem cell transplant. You know, and when I do my educational sessions, I always talk about how all of your cells come from your bone marrow. Your red blood cells, your white blood cells, and your platelets. Well, sickle cell disease is a disease of the red blood cells. And because your red blood cells come from your bone marrow, if I can, number one, get rid of your bone marrow, and then number two, give you someone else's bone marrow, then I can cure your sickle cell disease. But the problem is, that's risky. The other problem with bone marrow transplant is that you have to have a match. And so you have to have a brother or sister who matches you. And so there's a problem in terms of getting people that have matches.
It's definitely mind-boggling that the first official description in the medical literature of sickle cell disease came in 1910. That's so many years ago, and when you look at when it was first discovered and how much we have progressed now, it's very little in these years.
There are a lot of myths. And one is that it's a black disease. Well, it is a black disease, but it's not only a black disease. But I think sometimes it just gets looked at as it's a black disease, okay? And so, you know, we've got healthcare disparity, you know, we've got racism. So, yeah, there are reasons, you know. We don't have the kind of advocacy that we need. You know, a lot more money is spent on cystic fibrosis than on sickle cell disease, even though cystic fibrosis is less common than sickle cell disease. Another myth about sickle cell disease is that, particularly for young black men who have it, they all become drug addicts. That's another myth. And then when they go to the emergency room because they're in pain, it is what you call drug seeking.
Sickle Cell Disease Association of America, whose mission is to advocate for and enhance the ability to improve the quality of health, life, and services for individuals, families, and communities affected by sickle cell disease and related conditions, while promoting the search for a cure for all people in the world with sickle cell disease. This organization was a vision of Dr. Sherney's late father, Dr. Charles F. Whitten.
Well, my dad, Dr. Charles Francis Whitten, the single most influential person in my life, both personally and professionally, and just really an outstanding man. And what he said to me was that being a pediatrician and then getting 6 months of training in hematology, he noticed that in taking care of kids with cancer, there was a multidisciplinary approach. And in taking care of kids with sickle cell disease, there was not. So we were unable, our kids were unable to reach their potential because they weren't having all of their issues addressed.
Some may remember the sickle cell mobile created by Dr. Whitten that was often seen on the city streets of Detroit.
And the thing about this sickle mobile was that, of course, it was on wheels, so it went to you. And the other thing is that people would actually be tested right there. While they were being tested, they would view a video. Then they would get their test results right there on the spot, and if they were positive, they would sit down right then and there with a genetic counselor to learn about sickle cell disease and what it meant to have sickle cell trait.
Sickle cell anemia, has it been forgotten?
One day I was driving down the street, and I was listening to the Tom Joyner show, and they were talking about sickle cell disease. And Tom Joyner made the comment, it's like, whatever happened to sickle cell disease? Is it still around? And I was just trying my best, man, to just dial in, to let them know that the disease is still around. And there are a lot of people that are affected with the disease.
This disease is one that can be avoided just by having the knowledge. So many of us as African Americans, or people of brown hue, we don't go to the doctor. We don't know what's happening with us genetically. Just if we're aware, just if we educate ourselves. And that's what I'm trying to do even as I move forward in my musical career. Till I'm old and gray, right here with Brooklyn, right here with Brooklyn. Well, I can truly say it's the happiest I've ever been with Brooklyn. To marry everything that I do to sickle cell, bringing awareness to it, helping us to realize that it takes money, it takes funding to try to put into research to find a universal cure for this. It's not a forgotten disease.
You know, the Black Panther movement really brought up this whole issue of sickle cell. So I think back then, where we were a lot more politically motivated, I think we need to get back to that. You know what I mean? We need to get back to being fired up the way, you know, I mean, just even seeing people stand in line to vote when they were trying to disenfranchise us. You know what I'm saying? I think it's that kind of stuff that that will bring sickle cell disease back into the forefront of people's memory.
We have a project called RUSH where we are trying to register every individual living with sickle cell disease and do a survey so we can let the state government know what our issues are, that sickle cell disease is a public health issue, just like breast cancer. We're trying to get sickle cell disease to be raised to the level of breast cancer.
So we continue to rise, to bring awareness, to educate ourselves, to fight for a cure, to open our hearts and our minds, that one day we'll break the sickle cycle. Because sickle cell may be forgotten by some, but it's not gone.
I'm living with sickle cell.
I'm living with sickle cell.
But I'm living with sickle cell. I'm living with sickle cell. I'm living with sickle cell.
I'm living with sickle cell. I'm living with sickle cell.
I live with sickle cell. I'm living with sickle cell.
I live with sickle cell.
I'm living with sickle cell.
I'm living with sickle cell.
My name is Shanae and I live with sickle cell.